tell me when, Jamie.
Perfect. Bell's.
Well, we're here at the George Hall Center. They do incredible work helping families and children with mental health. And Bell, Let's Talk Day, thank you for Bell and all the support that everyone's given out there. Mental health is absolutely critical. We always say about physical health, but mental health is just as important. Our government has put $3.8 billion into mental health over the next 10-year period with the collaboration with the federal government. So we want to thank our partners at the federal region. But talking to Susan, that runs the facility, George Hall Center here, we need funding directly into these centers. We've increased funding by $194 million. That's on top of the $176 million that we have. But again, that gets spread out to all different areas, which are very helpful. The schools, they do a great job. The hospitals on the assessments doing great. But where the rubber hits the road is in centers like the George Hall Center. And I just want to thank Susan. We have Minister Elliott, Minister Tibollo here as well. It's absolutely critical that we get more social workers on the ground dealing with these families. Susan told me there's up to a year waiting list. In my opinion, that's unacceptable. It's not Susan's fault, but we'll make sure that we get the proper funding over and on top of what we're already pouring money in. When I first took office, we're the first government to have a Minister of Mental Health and Addiction. We're seeing this throughout the pandemic of people having challenges right now, and I just want to tell those folks, help is there. Please make the phone call. And along with our kids too, we have the Kids Help phone. Please just make the phone call and we'll be there for you. And that's my commitment. So thank you, everyone. Please stay safe, and we'll be there to support mental health and addiction. Thank you.
Vaccines. Ottawa
Yes.
released some new numbers. What were those numbers, and how does that react to it?
Well, it's disappointing. Our share of the numbers over the next couple of weeks is roughly about 33,000 vaccines. It's disappointing that now we hear a decline. We're going to be down. I think it's another 13%. Again, I know the federal government is trying, and they're doing everything we can. We need to explore every avenue possible, no matter if it's asking Health Canada to speed up the approvals on the J&J, Johnson & Johnson vaccine, or the AstraZeneca. We need the approval as quickly as possible. Pfizer has let us down tremendously. It's again unacceptable. You know, they have an obligation to meet the contract, and again they've let the people of Ontario down, let the people of Canada down. But we need a loud voice to make sure that we get our fair share of vaccines. It's absolutely critical, and the logistics around getting these vaccines out, and all of a sudden they pull back on the vaccines. It makes it very difficult for General Hillier and the task force table to have proper planning when you don't get what we're expecting to get. So Health Canada, please, we need your help. Please approve these. These have been approved other places around the world. Please share that information and get the vaccines out as quickly as possible.
Now, explain the difference between 5 and 6 doses per vial, and can we assure that we can get 6 doses per vial?
Okay, so if you don't mind, I'm going to bring the Minister of Health in. I saw it yesterday, and we saw a great doctor there with 1 syringe that's getting 6 doses. And when I asked the question to the team yesterday, they have, I believe it's a 3 millimeter. I better let the expert speak, because she'll know a lot better than I will. I'm sorry?
Well, thank you, Premier. Yes, in fact, you can get 6 doses from the Pfizer vial if you use the 1 milliliter needle. The 3 milliliter needle is much more difficult to do, but it can be done. We do have some experts in Ontario who are able to do that. So even if we run short of the 1 milliliter needles, we can still use the 3 milliliter needles, and we're giving guidance to all the people doing the immunizations so that they can get that 6th dose out of each vial. That adds to our load tremendously. It really, really helps us when we have this shortage of vaccines coming in right now from Pfizer.
But when you, rather than talk about doses or what's perceived to be doses in per vial, are we going to have the same number of arms vaccinated next week as we would have had, or are we still going to be short, even though we're getting 6 doses out of each vial?
Well, we're going to continue with our plan. This won't affect our plan because we want to make sure that we can have all of our vulnerable residents of long-term care homes and high-risk retirement homes at least receive the first dose by February 5th. And we're also holding some vaccines to make sure that the people who have received the first dose will receive the second dose. We need to do that to make sure that they are fully immunized and receive both doses as they need to.
Okay, so Minister, explain the difference between what we were expecting, and then as of yesterday, we were expecting 20% less. As of the noon phone call, how much less
Yes.
are we expecting from them, and how many arms are going to get vaccinated?
Well, we were expecting to receive 4 million doses to Canada by the end of February, first part of March. We've now been told that that's more like about 3.5 million, so we're short about 500,000 doses. However, we are going to continue with our program. It's not going to affect what we're going to do. We're going to continue to support our most vulnerable. But we are asking Health Canada if there is an approval for the AstraZeneca vaccine very shortly, because we need to supplement those vaccines that we're short from Pfizer. Thank you.
That's right. Thank you.
Hi, Minister. Today's Let's Talk Day. Comments about Bell Let's Talk?
Well, today's Bell Let's Talk Day, and I hope everyone is reaching out and using hashtag Bell Let's Talk. It's an important day. It's Bell raising money for mental health and addictions. You know, the pandemic this year has created even more of a demand for mental health and addictions. So it is really important that we give use the hashtag as much as possible, because Bell will raise additional funds, and those funds are going right to help organizations. And that is so important because, again, governments can't do it alone. We need to work together to ensure that anyone that needs help is able to get the help where and when they need it.
And how important is it, given the normal stresses of life, but given the fact that COVID has amplified that so much?
Well, mental health in and of itself has been a pandemic for long before we had COVID-19 as a pandemic. We know that the statistics show that 1 in 5 people in Canada are in need of mental health or addiction supports. We know that 500,000 people a day do not go to work because of a mental health issue. So it is important that we address those issues, but now with COVID-19, it's impacted even more. Moms having to be teachers, having to be spouses, having to look after their homes, perhaps not going to work because of the COVID-19 restrictions. We have children who are now not able to be in a social environment to help with their cognitive development. We have seniors that are isolated, that are not getting visitors to see them in the long-term care homes. All of us are suffering. And what we're doing as a government is making sure that we invest. And, you know, again, no matter how much we invest, there are going to be huge gaps that need to be filled. But we're working towards filling those gaps, making the investments to ensure that people have the help they need. And right now, virtually. So ontario.ca/mental health. Use the site. There are lots of readily available resources for parents, for their kids, for themselves. Internet-based cognitive behavioral therapy, and all kinds of other supports that are surely going to help them, including the Kids Helpline, which is, again, another resource that's great for kids.
How important is it to reach out, to talk about mental challenges with someone that you might know?
It's extremely important. I mean, when you think about our mental health and where we are today with the pandemic, a lot of us don't have routines anymore. So whether it's parents at home, whether it's seniors, whether it's children, they're used to routines, and we're creatures of habit. So one of the things that I say to parents all the time is ensure that you keep a routine in the home, whether it means, getting up at a certain hour, having breakfast at a certain time, and don't forget to let your kids be kids. Take them for a walk, and when you have the opportunity, sit across from them and ask them questions. How are you feeling? How are things going? Look for the signs. If they're not eating properly, if they seem restless, if they get emotional very quickly, if they are lethargic, they don't feel like socializing. When you see those signs, we have the help phone lines to be of assistance to the parents and to the kids so that they can interact and enjoy being children at a time that otherwise would be normal if they could go to school.
Without using names or anything, are you going to reach out to someone today?
I've actually already reached out to my mom, who unfortunately I haven't seen for months now because of wanting to protect her and keep her isolated. I've reached out to some of my friends that I know that suffer from anxiety and depression, and I'll continue doing that all day today because, again, it's important that we have that social contact. Physical distancing, not social distancing. And there's lots of ways to stay in touch with people you love, your acquaintances, your friends, whoever it happens to be. But it's important that we reach out to our friends, especially during these long, cold, dark days.
Thank you very much.